Hi, I'm Ingrid Larson, Director of our Beacon program at Children's Mercy, and I want to talk to you today about influenza and the flu vaccine. Influenza, or the flu, is a serious respiratory infection that affects millions each year, with higher rates of hospitalization and death in both children and the elderly population. Children younger than 5, especially younger than 2, older than 65, pregnant women, and people with chronic medical conditions are more likely to get complications such as pneumonia from the flu. While rare, unfortunately, children die from the flu each year. Children with medical complexity are among the most vulnerable to have complications from the flu virus. The best ways to help protect your child and family from the flu virus is to practice good hand washing and receive the flu vaccine. There's a lot of information out there, and I want to share with you the top 10 things to know about influenza and the flu vaccine. Number 1. The flu is a contagious respiratory illness. It is caused by the influenza virus and is associated with cold symptoms of runny nose, cough, as well as body aches, fatigue, and fever. The stomach flu, or vomiting and diarrhea, is not typical of the influenza virus. Number 2. You cannot get flu from the flu vaccine. The most common side effects are pain, soreness, or redness at the injection site. Number 3. Children with an egg allergy can still get the flu vaccine, but if there's a history of a previous reaction to the flu shot or anaphylaxis, which is a severe allergic reaction with eggs, check with your primary care provider or allergy specialist before receiving the flu shot. Number 4. Each season, the flu virus is slightly different. The flu vaccine is designed each season to protect against the flu virus that research shows will be the most common in the upcoming season. This is why you need a flu vaccine every year. This is also why sometimes you hear that the flu vaccine didn't work. That just means that it did not have protection against a particular type of flu. Number 5. Last year, the live attenuated FluMist nasal spray vaccine was not recommended because it was not shown to be effective to the flu strain in the community. Number 6. The flu vaccine is unfortunately not 100% effective, so it is still possible that you may get the flu illness even with vaccination, but it is the best prevention available. If someone still gets the flu despite getting their vaccine, it may be that they were exposed before the vaccine took effect, because it usually takes about 2 weeks for your body to develop immune protection, or that the flu vaccine was not a good match for the flu virus that year. If a person has received the flu vaccine and still gets the flu, the vaccine helps to make sure that the illness is milder. Number 7. Flu vaccine is essential for kids and strongly recommended for anyone else who lives or visits your home. If your child is aged 6 months to 8 years, they will need 2 shots the first time that they get the flu shot. These shots are 1 month apart so they can get full protection from the vaccine. Number 8. If your child is younger than 6 months of age, the best way to protect them is to avoid those who are sick, washing hands, and making sure that people who spend time with your baby receive the flu vaccine. Pregnant women who receive the flu vaccine pass antibodies onto the developing baby in pregnancy that can help protect the baby up to 4 months after birth, so we recommend the flu shot for pregnant women as well. Number 9. Getting the flu vaccine as soon as it is available helps provide protection. It won't wear off. The exception is those age 65 and older who may need a higher dose of flu shot to help it last all flu season. Flu is seen as early as October and usually peaks between December and March. Typically, the vaccine becomes available around October and is beneficial to receive as long as the flu virus is circulating. Number 10. Children's Mercy Hospital and many other facilities offer the flu shot. You can call your primary care provider to ask when the flu shot will be available for your child. Children's Mercy also offers a Friends and Family flu shot program for caregivers needing their flu shot. I hope this helped you to know a little more about influenza and the flu vaccine. All Children's Mercy employees are required to get our flu shots, and we hope that you will too. Please contact your primary care provider with any specific questions or go to the CDC website, healthychildren.org or kidshealth.org, and remember, you can always get a copy of your immunization record, including the flu shot, through the patient portal.